let me share with you a model, a quantitative model. That's why we are called QuantGene, because we quantify things here. So you understand why we are so excited about this model and why I want to share this with everyone, this opportunity that could change genomics and precision medicine forever. Pay close attention, because this is an interesting model that gives you a deep dive into hospital economics and what turnkey genomics can actually do and why it's such a powerful engine of transformation. So here you have a typical send out hospital, so a hospital that currently sends out their genetic testing. We are looking at a hospital of a typical size, 1 million patients, 2,000 cancer patients a year. What you see is roughly 150,000 of these 1 million patients would qualify for hereditary cancer testing. Most people don't know that, but it's 15 to 20% of the population under Medicare reimbursement guidelines. And in CGP, roughly 50% of the cancer patients, in theory, qualify for complete genomic profiling of their tumors, which is directly connected to life-saving therapies and clinical trials. But unfortunately, there's a lot of under-testing going on, but there are more problems waiting. It's not just the testing, it's also what is translated into clinical care effectively. And what we see is that because in CGP, a lot of things don't happen in time, and then they're not being fully understood by the physicians, that translates effectively only into 8% coverage. Out of the 1,000, only 8% actually get this. And that is being translated into targeted therapies on the rate of positives. So you only have 25 patients actually getting targeted therapy. Similar things are true also for hereditary cancer. So that leads to very low coverage. And on the revenue side, you basically see completely marginal revenue because there is nothing realized, just a little bit for the medical services. So you're talking about $10,000 a year, which is not a lot. Now, on the cost side for the hospital, what you see is, I make it short, roughly $900,000 in losses for the genetics team, right? You need a program. Now, here's what happens if you start implementing turnkey genomics in that hospital successfully. So first, what is turnkey genomics? Turnkey genomics is not a turnkey laboratory. That is misunderstood. Turnkey genomics is actually the implementation of the entire horizontal and vertical value chain required to implement precision genomics into care. That includes a laboratory solution with full setup, credentialing, and validation, but it also includes patient activation cloud systems that identify patients that need testing, because if you can't activate patients, your lab is useless. And finally, you also have a revenue management piece to the equation, where you help the hospital to actually realize the revenue they need to make. That leads to a massive transformation of the hospital. So before, you have 1,000 tests in total. You also have $900,000 of costs. So here, we increase the costs of patient activation to 1.5 million, but we are getting 16,000 tests done. So activation goes up from 0.7 to basically 10.5%. That's an enormous delta, right? Of basically 13x up. Suddenly, the hospital has a tremendous increase in patient coverage, which we'll see soon in a minute why this is so important. But let's start with the money. The hospital goes from negative $900,000 for the genomics program to positive $3.7 million in operating income that their genomics unit makes. We know we are doing this for patients and for clinical impact, but I tell you one thing, if you don't fix this first, and this is exactly how this is designed, you're not getting anywhere. That economic engine is the centerpiece of turnkey genomics, why it's such a powerful force for the entire genomics industry. Let's look at the clinical impact that this has, because that is why the clinical leadership wants in-house genomics so badly. So first of all, on the hereditary cancer level, on the population genomics level, we see an enormous impact. So this looks at the impact of hereditary cancer that is insourced into the hospital with a turnkey solution that includes revenue cycle management, but also patient activation. Over a 5-year period, you see an increase from roughly 3,700 tests to 75,000 tests. That's a coverage of the population from 2% to 50% in 5 years. More importantly, you now have positives, right, that are high-risk, genetically high-risk cancer patients that are in special preventative programs, going up from 281 patients out of a 1 million patient hospital to 7,500 identified genetically high risk for different cancers, Lynch syndrome, OBGYN cancers and so on. And that leads to a cancer detection rate in these 5 years from 28 of these high-risk ones detected to roughly 750, which translates directly into 11 lives saved versus 300 lives saved through early detection. Lives saved in the sense of 5-year survival and also long-term survival. And this is all backed by a lot of research, obviously. That's why this is all reimbursed. In other words, you are increasing life-saving measures by 2,500% in your population, and you are leapfrogging as a hospital from an average hospital to probably one of the top 1% hospitals in the United States in terms of precision medicine and preventive medicine. Let's take a look also at complete genomic profiling, which affects the actual cancer population, right? And what you see here is because we increase the translation, the CGP coverage, the amount of patients who are of the guideline recommended patients who actually receive complete genomic profiling and the consecutive targeted therapy coverage from 8% to 81%. We do that through extending the testing, but also implementing decision support systems and making sure every oncologist in this hospital actually is fully up to speed with the latest that we know in the guidelines, the latest FDA indications for all the precision oncology drugs. But here's the important number. We see that 1 year progression-free survival, one of the most important metrics in oncology. How many of your patients are progression-free and survive 1 year in after starting the therapy? And what you see is we are increasing that number by 27% effectively. If you as a hospital have the opportunity to increase the success rate of your most important and most profitable division, the oncology division, by 27% with the hardest success indicator ever for patients, you will do it. You will take the shot, especially if you get on top of it $3.7 million. So that is why turnkey solutions in genomics and the insourcing of genomics is so transformative for every hospital of that size. Before we go on, I want to also take in a little excursion here to discuss the industry impact. And I'm talking about the financial industry impact on the players in the industry. So here it gets even more interesting. Now, for our colleagues on the germline and somatic testing front, right? There's also enormous upside for at least some of our colleagues over there, because these turnkey solutions, they don't mean that we have to replace these with some tweaks in the business model. We can actually deploy these great, amazing technologies inside the hospitals. And because there's such a big expansion of the underlying testing volume, there is also an enormous upside in getting more money in here at a much higher margin if, for example, Invitae, Myriad, and so on would switch to only curation and focus on that. What you see here is we can increase that revenue for these players over here also enormously, right? By 195%. And even here, where the business model is actually more the data and the pharma deals on the back end, so of course, that would be a tremendous boost, as we will see in a second. And then, of course, finally, targeted therapies. Here we are talking very different numbers. But what we see here is the top 20 drugs in targeted therapies that need genomic biomarkers make roughly $35 billion currently in the United States alone. 70 billion worldwide. Because these drugs are directly linearly correlated with the amount of testing that's going on, because you can only prescribe these drugs if you have the actual underlying genomics data, for example, TMB or MSI status, EGFR, and so on. They need that testing, and that testing is not being done right now. It's heavily undertested. So the effect here is dramatic. And actually, I have built into that model a 50% price reduction, because that would need to happen in order to boost the volumes like that. New negotiation with Medicare. But still, even if you cut the price by 50% for all the precision targeted therapies, which would benefit patients tremendously, the revenue would go up by $120 billion to $150 billion from 35. So the targeted therapies are probably the biggest winner here in terms of just pure numbers. Not in percentage terms, there are bigger winners up here, but in terms of absolute numbers. So I have done this for quite a while. I've worked in genomics and worked on pretty exciting things for quite a while. But when I stumbled upon this model and we started digging into it over the last 18 months and talked to everyone in the industry, executives all over the place, from the best sequencing companies to other people who run very large genomics companies, everyone agrees that this has to happen. Everyone agrees that this model is where the future lies. And it really blows my mind, the opportunity we are all sitting on as patients, as the entire genomics industry, and of course as Quantgene. It's also interesting that of all the people I talk to, everyone wants to be part of it, but no one really wants to do the job. It's just a lot of work. And now we have these 18 months of work done at Quantgene, where we developed the framework, everything from legal compliance to the contractual frameworks with the hospitals to, of course, the entire technology platform, horizontally and vertically integrated. And now that we are at the precipice of closing the first hospital deal and implementing a model hospital of 1.5 million patients, it dawns on everyone what we are actually dealing with. It's something that can structurally change everything. And when I look at other industries, when these things happen. Think about self-landing rockets in aerospace, where everyone thought, that's not going to happen. And then it happened, and it has transformed everything. The humanoid robot platforms that we are looking right now, how it unfolds, that will transform human labor on a trillions and tens of trillions dollar scale. These kinds of platforms are what really makes people excited. And these kinds of platforms change everything. And I truly believe, now that I deeply understand all the mechanics behind it and all the dynamics of the different participants in this, I truly believe decentralized genomics is one of these. Decentralized genomics will initiate the greatest leap of progress we have seen in the history of medicine, because it is the economic engine that you plug into every single hospital in the world, starting with the United States, that will create a forcing function for the hospitals to embrace the deep rollout inside their population of precision medicine and precision genomics, leading all the way to discovery, to new drug discovery, to the deployment of the most advanced targeted therapies, to the unlock of an enormous AI opportunity, because you need data infrastructure and you need genomics infrastructure first. And you need something that makes everyone enough money so they get excited to actually do something. And in a time like this, with an opportunity like this, I think it will be decision makers in hospitals, with healthcare solutions providers, genomics tooling and technologies corporations, and of course, in venture capital, who can deviate from that proven path, recognize an historic opportunity when it presents itself. It will be these guys and girls who will capture most of the upside of this great, great transformation that we will see. It will be these guys who can deviate from these patterns and recognize a historic trend, a macro trend of enormous proportions when it happens, who seize the day, jump on this opportunity, and start working on it with us. So if you're one of them, please come on board. You know where to find me.